All right, so everyone, thank you for coming to this webinar about taking the taboo out of painful intercourse. My name is Katie Ouillette-Harrington. I am a doctor of physical therapy and I'm a pelvic health specialist as well as a sexuality counselor and sex educator. And I work for Renew Physical Therapy. Just a heads up, if you have any questions throughout the presentation or anything towards the end, if you hit that Q&A button, somewhere on your screen, it is anonymous, so you can submit those questions and we'll either read them out when they come up or we can talk about it at the end. So what we're going to learn in this presentation is understanding the basics of pelvic floor anatomy and function, so you know what's going on in your own body. You're going to learn about painful intercourse, which is the formal diagnosis is called dyspareunia. We're going to learn about common symptoms of dyspareunia and familiar treatments for treating that. So I'll talk a little bit about my background, so I'm not a complete stranger talking to you about sex. I have an associate's in applied science as a health fitness specialist from Delta Community College, and I also became a certified personal trainer through that. I have my bachelor's of science in kinesiology from CMU, and then also through CMU I did my doctor of physical therapy. And then through the University of Michigan School of Social Work, I became a sexuality counselor and sex educator. And then pretty much since graduation, I've been continuing to do postgraduate educational studies in pelvic rehab. In my personal background, I live in Midland with my husband and my 3 dogs that you can see here, and my 2 stepkids. And then I have 2 babies on the way. They are coming this summer. I am very active. I love running and CrossFit. I did my first half marathon this past summer, and we are big outdoors people. We hiked the Grand Canyon, which is that top picture here, and then that is my husband in the lower right-hand corner. That is a lake somewhere in the Rocky Mountains. I don't remember the name of it. All right, so let's get right into it. Talking about the aspects of health. So these general 5 categories, so physical, emotional, mental, social, and spiritual, those are the general considerations for your aspects of health. And here we can see how sexual health can fit into this paradigm. So sexual health has a direct role with physical, emotional, and mental health, these 3 on the right. And the status of your physical, emotional, and mental health can then affect your spiritual and your social health as well, as everything in this circle is interconnected. So we need to make sure we're considering sexual health is just as important as the other aspects of health. So making sure that you're advocating for yourself to your healthcare provider if you feel that something isn't right, which we'll talk about that painful sex more, but definitely make sure if that's coming up for you to talk to your provider, whether that be primary care, your OB, anyone that can pretty much write a script for physical therapy. You can talk to them about it because it's not something that you have to live with. So we're going to go over first the pelvic floor anatomy of a female body. So over on this left-hand corner, you can see where my cursor is. That is the bladder. Where my cursor is now, that is the uterus and the vaginal vault coming down there. And then behind is the rectum. And if you see these little kind of like reddish, pinkish blobs, those are your pelvic floor muscles. So they go all the way from the tailbone up to the pubic bone. And if we're looking at that picture on the right, this was if you're at the OB and you're in the stirrups, your legs are spread apart. That's what the OB is looking at. So obviously all of your skin is removed. This is the deepest layer of our pelvic floor. So we have 3 layers of our pelvic floor muscles. This is the deepest one. So this yellowish color on the side, that's your the top of your pubic bone here, and then these are like the bony parts of your butt or your sits bones coming here. This big meaty muscle in the back is your glute max, so that's like your biggest buttocks muscle. And then if we come right to the top, we can see this whole part is your vulva. So your clitoris is on the top. We have your urethra right under there. This is the vaginal opening or the vagina. And then we can see how your muscles surround here, coming down into your rectal opening. You have muscles that are coming along this side to your sits bones, ones that wrap around and then come to your tailbone down here. So a lot going on for our pelvic floor muscles. continuing to look at the female bodied anatomy, this picture on the left is similar to that last one we just looked on the right on that past slide. This one obviously has skin on top of it. So if we're looking right at the top, that is your clitoris. Coming down here, that is your labia majora, so the lips as they're mainly considered. Right below the clitoris, we have your urethra, or urethral opening, and then your vaginal opening. And then we have that anal opening down here. To the right of this is a great picture depicting how big the clitoris actually is. So all we see is that glans, which is that little opening, and then what covers that is the hood of the clitoris, which is not pictured here. That's just a tissue. So we can see how your clitoris comes all the way back. It runs right along the edges of your pubic bone. And a fun fact about the clitoris is that it has 10,000 nerve endings. Its sole function is for pleasure. That is the only technical organ in the human body, both male-bodied and female-bodied, that exists solely for pleasure. And it's very important for female arousal. And as a comparison, in the tip of the penis, which is also a glans, there's only 4,000 nerve endings. So there are quite a bit of nerve endings in the clitoris. And we'll talk more about that female arousal and why it is so important for people who have painful intercourse. So we're really quick going to go over pelvic floor anatomy of a male body. It's also important, and just in case we have any male bodies in here. So we have the same sort of setup. Obviously, they don't have a uterus, but we have our urinary bladder here. Their prostate sits below, and their rectum is right behind it. Out of the urinary bladder comes the urethra to the outside of the penis. We can see your penis is here, and the testicles are right below that. Again, we have our pelvic floor muscles. They're much thinner than a female pelvic floor because they have other things that help keep them continent. Women do not. We just need our muscles. And then here is that view down looking up. This one actually shows all 3 layers of the pelvic floor muscles and not just the deep 3rd layer that we saw before. So same setup. We have muscles that are lining along the bones here. We have muscles that are coming right to the middle, wrapping around the rectum, and then we have your glutes here. So functions of your pelvic floor. We talk about the 5 S's. So number 1 is support. So supporting the organs that I just took out of there. Actually, if I step out real quick, I can grab my model. So this is a female-bodied pelvic floor. So we have your 2 hip bones, and then from here, we can see your bladder, uterus, and then your rectum. And when we take those out, you can see how it's, I know it's blurry, inside like a bowl. There we go. Okay, so the support part of your pelvic floor is supporting the organs I just took out. So bladder, uterus, and then your rectum. If someone has had multiple vaginal births, if you've had tearing with vaginal births, have repeated heavy lifting, that can cause those organs to prolapse, which can also sometimes lead to pain. Sphincter control, so the muscles that are surrounding the rectal and urethral openings, those are our sphincter muscles. Those need to close off so we don't pee and poop when we don't want to pee and poop, but those muscles also have to be able to relax to let everything out. The 3rd S, which is stabilization, is stabilizing all of the joints surrounding our pelvis. So our sacroiliac or our SI joint, our pubic bone on the front, low back, hip, pretty much any joint around there. So if someone is having chronic pain in that area, it's not getting better, they've tried physical therapy, chiro, all these different things, it's not helping, and you haven't addressed the pelvic floor, there's a very good chance the pelvic floor is involved. And then sexual function for our 4th S. So our muscles make sure when they're functioning properly, help with the ability to have an orgasm and then pleasure with sex. On the opposite end, it can lead to pain with intercourse if they're not functioning properly, which is why we're out here today. And then the 5th S is a sump pump. So as you can see in this image to the side here, a pistoning motion happens with a diaphragm breathing. So a diaphragm right here is our main breathing muscle. It's this top one on the front. And then we can see your pelvic floor muscles are down here with all of your pelvic organs. So this is your diaphragm, and this is your pelvic floor. We'll do this. When you breathe in, your diaphragm lowers and flattens, and then so should your pelvic floor. When you exhale, it comes up. Why this is important for people with pelvic pain, or really pretty much anyone in general, we need to make sure we are breathing with our diaphragm, because that helps with our pelvic floor functioning properly. And if someone is in chronic pain or you're in an anxious state, we tend to chest breathe. If we chest breathe, that doesn't move the pelvic floor, but it also will worsen anxiety. If your anxiety is worse, you're going to chest breathe. So you get in this circle. That diaphragm breathing helps you get out of that circle, which is what we're going to practice on this next slide here. So I want everyone to sit with your feet flat on the floor, and then I want you to do a body scan. So make sure all of your muscles are relaxed. So eyebrows, forehead, jaw, neck, shoulders, belly muscles, butt muscles, pelvic floor, head to toe, all the muscles are relaxed. Make sure you're especially not holding tension in your belly or your butt muscles. That will automatically tighten the pelvic floor. And then place one hand on your belly to make sure you're taking deep breaths and we can feel our diaphragm move. This is good to complete anytime you might have anxiety or you're stressed out, or just in general. All right, so we get the picture there and the gist of that, of how it should feel to work with your diaphragm. That's called box breathing. So as you can see, you're breathing in, you're holding, you're breathing out, you're holding. If you tend to get like short of breath, like me because I'm pregnant, or if you have any health conditions that will make you get short of breath or dizzy, please stop doing it and maybe not hold your breath and just work on that deep breathing. So great exercise to practice pretty much for anyone for any reason, but especially if you're in a highly anxious, stressed, painful state. So let's go over function of the pelvic floor with a female-bodied arousal. So sexual response in women involves psychologic, emotional, and social factors in addition to the physiologic events that we are more familiar with. So this is very complex, but there has been clear evidence of physiologic events that occur. So we know that increased blood flow to the genitals happens with arousal, because when a penis owner becomes aroused, most of the time they'll get an erection. The same tissue that makes up the penis also makes up the clitoris. So when a vulva owner becomes aroused, the clitoris is essentially getting an erection. It causes that swelling or that erection that we would see in a penis. There can be changes in this process. So it's not necessarily how it happens with everybody. So generally vaginal lubrication will occur at that point, but arousal does not always equal lubrication or an erection, and vice versa. So one can be present without the other. So know that even if you're not naturally lubricating, that might be just the way that it is in that point. But in that same case, sometimes there are things that are wrong. So if you are having a hormonal imbalance, going through menopause, you're breastfeeding, certain side effects of medication can cause dryness and natural lubrication to not occur. And also, so if that happens and you're still aroused, it doesn't mean you're not aroused. That just might be an event that's happening in that point in time. So if there are changes in normal functioning of the pelvic floor, like pelvic floor weakness or hypertonicity, meaning the muscles are too tight, this can result in less intense orgasm or pain with penetration, respectively. So that pelvic floor weakness can lead to less intense of an orgasm, or tightness can lead to pain with penetration. Now, you can have tightness and weakness at the same time, so you can have both a less intense orgasm as well as pain with penetration. Lack of lubrication and genital atrophy, which commonly occurs with menopause, may also interfere with sexual functioning. So with arousal as well, with vagina owners, we see that the vagina lengthens and dilates. So we need to make sure we are taking the proper time for that arousal, which on average 10 to 20 minutes, depends on the person. You have to think of a vulva owner's arousal is like an oven. It needs to preheat. We need that time for those physiological changes to occur. And then during an orgasm, rhythmic muscle contractions occur in the vagina, the uterus, and the anus. So all those pelvic floor muscles we saw, you have rhythmic contractions. So these are all important things to know, so you know why arousal before penetration is important. So if we go back to how the vagina lengthens and dilates, it's so it can accommodate either a penis or a penis-shaped object. So if you are someone who has pain with intercourse, having that time to have that arousal period will help accommodate that and hopefully have less pain. So function of the pelvic floor with male-bodied arousal. So blood flow also increases to the penis with arousal, like we know. The pelvic floor muscles help compress the veins in the penis and the outer part of it, so it traps the blood, and that creates and maintains an erection and will also contract rhythmically for an orgasm. When we have dysfunction here, let's say we have weakness, the outflow of blood cannot be maintained and therefore an erection cannot be maintained, and an orgasm may be difficult. If they have an overactive pelvic floor, an erection can't be maintained due to compression of the artery that provides blood to the penis, so they're not getting enough blood in, and that can cause pain. So with weakness, the blood's coming out too much, not maintaining an erection with the overactive pelvic floor, you're not getting enough blood. All right, so pain with intercourse, aka dyspareunia. So dyspareunia is genital pain that occurs before, during, and or after intercourse. So if you do have pain with intercourse before, during, and or after, know that this is common, but it doesn't mean you have to live with it. It is treatable. This can occur, as we just learned, with both vulva and penis owners. So primary pain, actually we'll go through the types. So you can have superficial pain, which is right at that vaginal opening, so initial penetration. You can have deep pain, so when the penis or a toy or something is all of the way in the vagina, then that causes pain. And then you can have both. So if you have one, doesn't mean you can't have the other. And then we have what's called primary, secondary, complete, and then situational. So primary pain is this ever since you've been sexually active. So immediately upon becoming sexually active, you've had pain since. Secondary pain develops after experiencing pain-free sex. So you start having sex, there's no pain, no pain, no pain, no pain. Then you have an instance of pain. Complete pain means you have pain every time you have sex. Situational pain only happens in certain times. So for some people, they only have it in certain positions, or if they're not aroused enough, or if they're not using lubrication. So how common is it? It is more common in female-bodied individuals. The pain is often due to physical factors or medical conditions, but it often can be psychological. So with those physical factors, with those pelvic floor muscles we talked about, we could have some dysfunction there. Medical conditions could be side effects of medication, and then psychological factors, mental health illness, stress, unhappiness in the relationship that you're in, which we can talk about that later too. And this affects 10 to 20% of people in the United States at some point in their life. So symptoms of dyspareunia: sharp pain during penetration or at the entry, deep pain during thrusting or full penetration, throbbing or aching after intercourse. This could be vaginal, pelvic, in the penis, or after intercourse, burning pains, pelvic cramping, muscle tightness or spasms, and then pain during or after orgasm. In just 1 second, I have my computer plugged in, but it's telling me that it's not charging. So 1 second. Which is concerning because my battery's almost dead. All right, hold please. Yeah, try another plug. Okay, we're good. It's charging. All right, thank you for that intermittent break. All right, so for this next slide, I will say that this is a trigger warning. The next slide will briefly discuss how sexual abuse and trauma can relate to pelvic pain. This is something I see quite commonly. So if you feel that you may be triggered, feel free to step away from the presentation and come back when you feel comfortable. This next slide should only take a few minutes. So I'm going to go ahead and move to the next slide. So common causes for female-bodied individuals. So overactive pelvic floor muscles can often cause pain. This can be generalized tightness. You can have pelvic or abdominal pain conditions like interstitial cystitis, which is IC, endometriosis, PCOS, which is polycystic ovarian syndrome, chronic pain somewhere else. So just because you might not have pain that originated in the pelvic floor does not mean that chronic pain somewhere else can cause pelvic pain. There is a link between TMJ disorder and pelvic pain because generally we tend to hold tension in the midline of our body, and you can't get any more midline than the jaw and the vagina. So if we're holding tension here, it's likely we're holding tension in our pelvic floor causing tightness. With low back or hip pain, those muscles are so close to the pelvic floor that if there's pain there, we're generally bracing and squeezing. They can cause the pelvic floor to tighten. And then a history of sexual abuse or trauma. So with that, the body, if we think about the body keeps score of what happens to us. So if you have experienced sexual abuse or trauma, the brain or the body will do what it's meant to do, and that's protect you. So many vulva owners will tend to hold trauma in this area anyways, like in our pelvic area. And so that's how the body protects itself, is to tighten and brace, kind of like I talked about. When something hurts enough times, you tend to brace to protect it. So tightening and bracing over time will cause the muscles to shorten, which can cause pain. And the body doesn't know that it's no longer in a fight or flight or survival mode. It doesn't know that it's safe to shut that off. So it stays in that heightened position. And how we talked about, if you're in that heightened position, you chest breathe, your muscles stay tight, and you're hypervigilant. Your body doesn't know that it can relax. So with this, it's really important to pursue interventions with a professional when you feel that you're ready to process it. Because some people, we humans in general, when something is stressful and traumatic like that, if it's traumatic enough, our brain kind of takes it out and puts it in a little box and shuts it. So we might not remember very much of it. We might get triggered and we don't know why. It's because this little box is shut and it hasn't been processed. But you need to make sure you're ready to process it because it's going to bring up probably a lot of emotions that are difficult. I suggest seeing a licensed mental health therapist that has specialty in treating sexual trauma. Interventions like EMDR can be very helpful with that. It's a great treatment for PTSD. So if you are looking for someone that does that, definitely look to see if they are trained in that specialty. I know at least of one therapist in Midland that is. And if you'd like the information, you can definitely feel free to email me. So that is all of that is. So if you would like to come back to the presentation now, if you can hear me, we are over that topic. All right. So postpartum can also cause pain, vaginal or C-section delivery. So with postpartum, we'll talk a little bit more about that later. Hormonal changes that happen with pregnancy, chest feeding or breastfeeding, and then menopause or vaginal atrophy. So when those hormone changes happen, it can change the lubrication that naturally occurs, or with the menopause, it's causing those muscles to become smaller, which can cause pain. And then psychological or relationship issues. So with psychological issues, anxiety and depression and low self-esteem can prevent sexual arousal. And then treatment for those conditions with the medications that are commonly used can also cause difficulty with sexual arousal and orgasm. And then with relationship issues, if you're not happy with your partner, this can actually cause pain. So even if you're not aware of it, your subconscious brain is aware of it and knows that for most vulva owners, sexual encounters are very emotional and intimate. If you don't feel intimate and comfortable with being emotionally intimate with your partner, there's a good chance that you might not be able to get aroused. If you don't, the brain is again trying to protect you. So seeing a mental health therapist to further assess this and see if couples therapy could be recommended if that's something you're wanting to pursue or seems right for you. So when I was in my training, one of the instructors told a story about how she had a patient that was having pain with intercourse, but it was only with the person she was having an affair with. When she had sex with her husband, she was not having pain, but she was having pain with the person she was having an affair with, and that was it. So that's definitely a psychological component that was contributing to that. Some more causes with female bodies. So certain medications, like I said, can cause decreased libido or natural lubrication, vaginal infections, problems with the cervix, which is the opening to the uterus, problems with the uterus itself or the ovaries, STIs, ectopic pregnancy can cause pain, skin disorders affecting the genitalia, and then pelvic inflammatory disease. So penis or penis-shaped objects can actually reach the cervix with maximal penetration. So sometimes this tissue can be sensitive and causes pain, which is if it's hitting the cervix, because that, like I said, it's very sensitive. Other times there could be an infection in the cervix itself causing pain. So if you're having pain with deep penetration, especially in certain positions, that could be why. And then with the uterus, fibroids in the uterus can cause pain with deep penetration. All right, vaginal changes postpartum. So kind of what we talked about earlier. So our pelvic floor goes through trauma through vaginal delivery. I mean, you look at that. I mean, you have a decent sized head baby coming out of your vagina. Things can rip. You can have tears, or if you have an episiotomy, which we can see here where that arrow is, episiotomies are when they purposely cut the tissue to help get the baby out. So after you tear or have an episiotomy, if you get stitches, even if you don't get stitches, scar tissue can build up. That tissue might not move around as well, and that can cause pain. Dryness or irritation if you're chest feeding due to hormonal changes, which we talked about before. That scar tissue, and then I do commonly see pelvic floor tightness and overactivity in the muscles following a C-section. A lot of times that's because the core is weak due to it being cut into, and the pelvic floor tries to take over to stabilize that area, and so it tries to do it too much, and then it becomes too tight. Causes for male bodies. So foreskin damage. So damage to the foreskin, the skin that covers the head of the penis, caused by rubbing or tearing can lead to pain. You can actually get yeast infections or other infections under the foreskin, as well as common STIs like herpes or gonorrhea can make sex painful. Penis deformities itself, so Peyronie's disease, is when there's tightening on one side of the penis, so the penis can change its shape. Not even just a little curve, you can get a pretty good angle in there. That can cause pain with intercourse for both the penis owner and the person they are penetrating. And then they can also get painful erections and pelvic pain, also due to overactive muscles. So we do Kegels to fix all pelvic floor problems, right? I love David from Schitt's Creek. And if you've watched that show, you can just hear his voice. Absolutely not. So most often, those with pelvic pain and pain with intercourse have overactive pelvic floor muscles, and a Kegel is where you're lifting the pelvic floor, so you're squeezing it. So if we already have overactive pelvic floor muscles, completing Kegels will likely make problems worse. These individuals who have the overactive pelvic floor muscles need down training, which is the opposite of Kegels. And so we'll go over some of that in the next few slides. So Kegels are not the end-all be-all to all pelvic floor conditions. And if someone tells you, if you have a pelvic floor condition, they say, just do your Kegels. Please don't do Kegels until you figure out what is going on with your pelvic floor. So common treatments for dyspareunia. So these are the most common treatments that we use. We're going to go over specifically pelvic floor PT, sexuality education. Sexuality counseling or therapy will be something that you can pursue through a mental health therapist, whether that's in person or online. And these interventions to address medical-related issues will need to be discussed with your medical provider. So this can be an OB, primary care provider, or urologist, or a colorectal doctor. So a lot going on this slide, but we will go through it all and hopefully make sense of it. So pelvic floor therapy specific for dyspareunia. So pelvic floor therapy is a great option, and after ruling out potential medical issues, this should be the first line of treatment for this diagnosis. If your medical provider doesn't mention it when you tell them you have painful intercourse, you can absolutely ask for a referral. Most of them are more than happy to do that. So a detailed examination would be completed by a pelvic floor therapist. This can include an external and internal pelvic floor examination to assess the skin integrity, muscle tone, which is how, is it tight or is there like no tone at all? Strength and control or coordination of the muscles, and if pain or trigger points are present. So with our trigger points, we know that like with our shoulder and neck muscles, we can get a lot of trigger points there if those muscles are overactive. The same thing can happen with the pelvic floor. So with that internal and external exam, your therapist will decide if that is even necessary for you. This is something you do not have to do. It is, you absolutely have a say in what is done for your assessment and treatment. And your therapist will help you decide what interventions are right for you and what tools you will need. So with all of these interventions that are on the right side of the screen, not everyone will need the same combination, and there's not a blanket treatment for everyone. So if I treated 10 different individuals with this, their treatments aren't going to look exactly the same. So breathing mechanics is what we've talked about making sure that you are using your diaphragm, so your pelvic floor is moving. Down training of overactive or over-recruited muscles. So we might need to do some strengthening and lengthening of the muscles. We might need to do dilator training or use of a trigger point wand, and those are great to use as a self-treatment at home. Or internal manual that's done by the therapist, and that's to also help with muscle tone and length or trigger points. Mindful meditation that helps you be more aware of your body and what's going on with it so that you are able to relax it when you need to relax and tell when you're holding tension. Core and hip strengthening or stability exercises. If you do have any dysfunctions there, sometimes that when we train those muscles, the pelvic floor will actually relax a little bit so it's not too overactive. And then modalities like cupping. So if you've seen people who have those like circle bruises, like Michael Phelps made it a huge thing in the United States after the 2012 Olympics. Gua sha or scraping, dry needling, and then manual or massage therapy. I do a lot of dry needling. I think it's very, very helpful, which is just like an acupuncture needle. So it's very small. We put that into the muscle where there's pain or trigger points, and it helps it relax. All right, educational interventions. Communication, the key is. So the importance of arousal and foreplay. We talked about this earlier. We need time for that arousal and foreplay so the vagina can widen and lengthen and hopefully self-lubricate. If you do have problems with lubrication, the use of a lubricant will be very helpful. I always recommend a water-based lubricant with not a lot of ingredients in it, because sometimes those ingredients can cause irritation to vulvar or vaginal tissue. Communication with your partner. This is super important. So if it is causing pain in certain positions or just sex in general, make sure you are talking to them about it. Communication is key in any part of your relationship, so it's no different with sex. And then cease activity if it causes pain. So if you continue to do an activity that results in pain, the brain is going to make a connection that activity equals pain. So your pelvic floor will tighten even with the thought of penetration of any kind. Even when anything comes close to it, it's going to tighten. So they're like, this hurts. I don't know why you're doing this. I don't want that. And very often, as this activity becomes closer, yes, it will tighten. And so the good news is that connection can be undone, and we can work to create a new connection. So we can undo the connection that penetration equals pain, and we can make a new one. So these are some resources, different books that you can read or look into. I broke them up by different reasons of why you might have pelvic pain. So sexual abuse and trauma, pelvic pain in general, and then menopause. And then Kate will actually be emailing you after this presentation is done. That will include my contact info, this resource list, and the recording. So you will have this list of books. Local or virtual support groups, many of them, I'm sure there are many of Facebook groups that you can be a part of that will help you not feel like you are alone, especially with people who have like endometriosis and PCOS, those specific diagnoses. It makes you feel like there's not something wrong with you, which there isn't. Your body is reacting the way that it is. But it helps to know that you're not alone and someone else is experiencing the same thing you are. So highly recommend those. And then these are all of our locations across the Mid-Michigan area. So Renew has 16 different locations. We specifically treat pelvic floor at Bay City West, which is me. We also have Caro, Midland, which is also me. And then we have 2 therapists at our Saginaw Pelvic Health location. So does anyone have any questions? I don't know if anything came through the Q&A. Like I said, that is anonymous. So if you do have questions and you put them in the Q&A, your name will not pop up. And if you have any questions you think about later, you can absolutely email me.
I did get a couple questions that came in when people registered. We had a little box where people could submit.
Okay.
Somebody asked specifically about having pain and just being not interested after menopause. So I was wondering if you had any kind of starter tips they might try.
Yeah, so that is definitely common after menopause. Your hormones are changing, your body's different. Exploring different ways of intimacy with your partner. If you don't want penis and vagina intimacy, that is a great starter. And then general pain for postmenopause could be due to dryness, atrophy, so talking to your OB-GYN, and then also coming in for pelvic floor therapy could be very helpful. If you haven't already, I would definitely look for a water-based lubricant that can be helpful. If you do have vaginal atrophy, your doctor might recommend a local estrogen cream that goes right into the vagina, and that helps kind of bulk up those tissues. And then with pelvic floor therapy, like what we learned here, we could work on downtraining the muscles. And then if you are specifically like not interested in sex itself or like intimacy, a couple of those books might help, or going to a mental health therapist could be helpful too if there's an underlying issue there. But it is very, very common to not have that interest after menopause.
Okay, and we have one more unless anybody wants to submit a last minute one. And this doesn't have a lot of detail, but they just asked about hymen regrowth and if that plays into this at all.
Yeah, so our hymen is our tissue that covers our vagina. Some people have it, some people don't. And that can, that tissue that's left over can cause pain, absolutely, if that is what they're talking about. So that can be very common to have pain with initial penetration, because it's at the, like if this is the vagina, this is the back side or the downside of your vagina where the tailbone is, that's common to cause pain there. And if I didn't answer your question and you're on here, feel free to email me.
Sounds good. I think that's all we had for questions.
All right. All right. And then thank you for your time and for coming to this webinar. Like I said, I'm at the Midland and Bay City West locations. If you want to have or get more information, you can go to our website, which is www.renewpt.com/pelvic health. You can see the different therapists and different locations we have. My email is there, and then like I said, with your follow-up email, my contact information will be there.